Okay guys, in this video we're going to be talking about mixing insulin. So the reason we would have to do this is if we have two orders of insulin at the same time. And most importantly, when we end up having to do this, sometimes we have a insulin that is cloudy. If you see this one is clear. The main purpose of this video is to show you how to mix the two insulins without contaminating either bottle. So the first thing we're going to do is obviously gather our supplies. We need our sub-Q syringe. That is a insulin syringe and it comes in units. We have our two insulins, some alcohol swabs. This is for when we administer, and then some gloves. So I'm going to go ahead and wash my hands. I'm going to don my clean gloves. And then we will go ahead and get started. So first things first, before we even start drawing up insulin, the cloudy insulin has particles in there. So we need to make sure that it is mixed properly, and we cannot shake this bottle because it will mess up the medication. So what we need to do is we need to roll it in our hands just like this. That will shake it up good enough for us. Once that is done, we can go ahead and get started. So first things first, open the two insulins up. Even though I just opened these, we're going to go ahead and clean these just to make sure we prevent the spread of infection. And then we'll let those dry. I'm going to check my order for educational purposes. We're going to say that we have an order for 10 units of regular insulin and 10 units of NPH. So a total of 20. That is an important part. We need to calculate what the total is to make sure at the end we calculate the right amount. That'll go in my garbage. Now that these are clean and dry, we can go ahead and start drawing up our insulin. So just like drawing up out of any vial, first things first, we're going to inject air. Now, we cannot mix once we have pulled our regular insulin, we're going to go into the cloudy. We cannot pull from our cloudy and then pull from our regular because that cloudiness can get into the regular vial and then contaminate. So what we're going to do, we are going to inject air into the cloudy first, then the regular, then we can invert, pull out our med, go back into the cloudy, and then pull. So we are going to open our needle. This does have a safety for after we are done injecting. We are going to go to 10 units. Nice and slow. The top of our plunger should be at 10. Then I'm going to inject 10 into our cloudy. And I just injected air. I didn't pull in any med out, so I can go back into the regular. I'm going to do the same thing. Go back to 10. And I will go into my regular insulin. And the reason we are injecting air is to create a vacuum to make it easy for us to pull the med without any bubbles. Now I'm going to invert, and I'm going to pull out my 10 units. Nice and easy. Now that my plunger is at the 10, I can pull out. Now I will go into my NPH. I've already injected the air, so all I need to do is inject, invert, and I'm already at 10. I have an order of 10 for NPH, so I will go to the next 10, which is 20. Make sure that my plunger is at 20, and then I can pull out. Now I have pulled my 20 total units of insulin. I have not contaminated either of my vials, and I'm ready to inject. For sub-Q, if you remember, we will be using a 45 to 90 degree angle depending on the patient's fat percentage. Please refer to your med admin video for how to administer a sub-Q. That concludes our skill, guys. We'll see you in the next one.